Hello. Many thanks to the Board of Directors and to Mrs. Amantha D'Souza, Program Director, for inviting me to participate as Director of the Special Program Advances in Retina and Ocular Biotechnology in the 18th European Ophthalmology Congress at Rome, Italy. It's very important for me to participate in this event and in this opportunity from the Rio Gallegos city, province of Santa Cruz, Patagonia, Argentina. Rio Gallegos is one of the most austral cities in the world. I want to take this opportunity to share with you part of my STEM research work. I want to introduce myself. I'm ophthalmologist, vitreoretinal surgery specialist, and professor at Cambridge University. For many years, I've been involved in ocular biotechnology research, such as intraocular macroimplants, microchips, and application of the stem cells in retinal diseases. Of these research works, I obtained some patents, and two were awarded by Cambridge University, New York Academy of Medicine, and California University. With this presentation, I want to start the work that I chose to share with you: stem cells therapy, intravitreal regenerative effect in the retinal neuronal degenerative diseases. Before entering the work, I want to make an introduction about stem cells classification and how to obtain them. Thank you.
Why stem cells? Stem cells are the future of regenerative medicine. For some time, there have been controversies between religion and science. Professor Dr. James Edgar Till, professor of the Yale University, recognized as the father of stem cells. 1963, Professor Till discovered that cells transplanted from the bone marrow into the spleen of rats self-replicated. Making a brief introduction about stem cells. Are cells able to divide and give rise to cells similar to progenitors? They have self-renewing ability, meiotic divisions, to continue the differentiation for which is programmed. Types of stem cells. Embryonic stem cells are obtained from the blastocyst. Germline stem cells, derived from gonadal outlines of the embryo. Fetal stem cells appear in fetal tissues and organs such as blood, liver, or lungs. Adult stem cells. Undifferentiated adult stem cells found in adult tissues and organs. Where are stem cells extracted from? Embryonic. Human embryo, totipotent or pluripotent. Adult, bone marrow, blood, liver, umbilical cord, placenta. Type of cells that can be generated. Totipotent, produce cell embryonic and extraembryonic. Pluripotent, produce embryo cells except placenta and others. Multipotent, produce cells of several lineages. Oligopotent, produce cells within a single lineage. Unipotent, produce a mature cell type. Methods of obtaining: cryopreserved embryos, single blastomeres, fertilized ovum are used. Activation of oocytes by somatic nuclear transfer extracts the nucleus from an unfertilized ovum and is replaced by the nucleus of an adult cell. The therapeutic use of stem cells has been a breakthrough in the past few years. Bone marrow stem cells have been used for 10 years in the management of blood diseases such as leukemia. The research of the use of this type of cells in the treatment of degenerative diseases has increased dramatically during the last decade of the past century, thanks to the advances of genetic investigation. The results of stem cells research have been successful mainly in the heart diseases. Despite their success by results, our knowledge on their use is still limited, several questions are still to be answered before we can make more effective use. The interest of stem cells in ophthalmology is the treatment of retinal degenerative conditions, retinitis pigmentosa, age-related macular degeneration, myopic degeneration, all the scar-forming diseases of the retina, corneal disorders, scars, dystrophies, some ecstasias. To reconstruct the corneal tissue are used stem cells obtained from the pulp of primary teeth or milk teeth.
After this introduction, which I hope you liked, I'll begin to detail of this research work. I've omitted some detail of the development of the work because they're very specific, but whoever is interested in this detail, you can contact me to my personal email, which I'll give you at the end of this presentation.
Stem cell therapy, intravitreal regenerative effect in rabbits with retinal neuronal lesions. This research was carried under the direction of Professor Luis Abad, with the collaboration of recognized specialists in ophthalmology and the support of the University of Belfast. Stem cells are withdrawn from the adult bone marrow of the rabbit's hip and injected intravitreally, improving the performance of retinal cells such as photoreceptors. The damaged cells are restored in their form and function. Adult bone marrow contains cells which are able to differentiate into cells of lineage, hematopoietic and not hematopoietic. In ophthalmology, we work with adult stem cells because they are easy to guide, since we work with embryonic stem cells in some cases developed a tumor. It has been recently demonstrated that NHL cells include population of endothelial precursor cells, EPC, which are able to form blood vessels. It has been demonstrated that there are a close relationship between non-hematopoietic and retinal astrocytes during the normal angiogenesis and during the pathological vascular degeneration. In this study, we have evaluated the effect of stem cells on the healing process after chorioretinal damage induced by laser photocoagulation. Material and methods: 30 male New Zealand albino rabbits with an average weight of 3.5 kilograms and 5 to 6 months of age were used. The animals were used in agreement with the resolution of the Association for Research in Vision and Ophthalmology, ARVO, for the animal use of investigation, with the permission of the Ethics Committee of Belfast University. Anesthesia. All the animals were anesthetized by means intramuscular injections of 50 mg/kg body weight of ketamine hydrochloride, Ketalar, 5 mg/kg body weight of xylazine hydrochloride, Cupazine, prior to the extraction of bone marrow, laser photocoagulation and intravitreal injection. The rabbits were used for the evaluation. Collected bone marrow stem cells, typified with tunnel and intravitreally injected. A needle of bone marrow puncture was inserted in the iliac crest of 30 anesthetized rabbits, and the bone marrow was aspired by means of 20 ml eponized syringe. The samples were prepared by 3 procedures. Samples in each procedure. 1. Whole bone marrow. After the collection of 1 milliliter, the sample was homogenized. The sample was discarded when blood clot appeared. Centrifuge marrow. 2 milliliters BM was centrifuged for 10 minutes. The supernatant was removed and 1 milliliter of the homogenized sediment was used. In both procedures, 1 and 2, the samples were placed on a cell counter. Surgery for the extraction of stem cells. A bone defect was surgically created in the reduced bone. A 1 cm osteoperital segment located 3 cm to the radiocarposulnar joint was removed. in order to allow the evaluation of the techniques of bone marrow application. Pupillary dilatation. The pupils were dilated by 1% tropicamide and 2.5% phenylephrine. Laser. A red diode laser 670 nanometers was used. 50 symmetrical laser burns with a preset intensity of 600 milliwatts and a 100 micron spot were delivered within the area of 500 to 3000 microns. 5 days after accomplishment of the bony sheet, the procedure was performed under general anesthesia. Laser marks on the temporal area of the rabbit's retina. Zone of central vision, since rabbits lack of lutea macula. A. Image obtained after 48 hours of laser treatment. B. Image obtained a month of the laser treatment. Arrow showed the increase in the size of the scar caused by laser action. Stem cells implantation. The stem cells was previously typified with apostosis marker, 1 mm of integral marrow. 24 hours after laser photocoagulation, the rabbits were prepared for the intravitreal injection of stem cells. The stem cells were implanted via pars plana to 2 mm behind stereocornal limbus. The collection of samples consisted of simple procedures performed with minimal bone trauma. A syringe with prior heparinization was used to collect the material and did not prevent the osteogenesis of the cells. Ancillary examinations. All groups were examined by biomicroscopy, tonometry, indirect binocular ophthalmoscopy. Before implantation and each week until the completion of the 3 months of investigation. 22 eyes presented. Conjunctival chemiosis and hyperemia in the area of intravitreal injection. They did not present inflammatory cells in anterior chamber, congestion of iris vessels, cataract, vitreous opacity, retinal vessel dilatation, neovascularization. Electroretinography was performed in all 30 rabbits before the stem cells injection and then weekly until the 3 months of follow-up were completed. The retinal function was evaluated under scotopic and photopic conditions with a stimulus-type flash using a Ganz-field device. The alterations were considered in order to reduce the effect of the individual and daily variations of the V wave. Histopathological study. The eyes were enucleated and preserved at -80 degrees Celsius. Light microscopy was performed on 15 eyes and transmission electron microscopy of 15 eyes. The posterior half of the ocular glove was separated by equatorial incision following the insertion of extraocular muscles, and immediately divided in 2 halves by an horizontal cross-section passing across the optic nerve. The posterior segment of the eyes were examined by transmission electron microscopy, were trimmed and fixed on chemicals, were sagittally sectioned and finally maintained for 24 hours at 4 degrees Celsius. Fine 500 micron sections were performed with a Leica ultramicrotome of glass slides and stained with 1% toluidine blue and finally analyzed with light microscope. Histological sections of the rabbit chorioretinal tissue were observed by transmission electron microscopy. A and B, enlarged photoscanning electron microscopy of the retinal pigment epithelium, RPE, 48 hours after the laser impact. Large areas of continuous solution are observed at the retinal tissue level. A and B, enlarged scanning electrons microscopy of retinal pigment epithelium at 90 days after the implantation of stem cell. Arrow shows some areas of healing. Histological image of the rabbit retina. Control group without stem cells implant. Cut done 48 hours after the laser impact. Arrow shows inflammatory lesion by the cicatrization action. Histological image of the retina of another rabbit of the control group, a month of accomplished the laser impact. The irregularity of the retinal tissue, arrows, is observed. Histological image of the rabbit retina of the control group, observed at 90 days of the laser impact. A large area of cicatricial gliosis is observed. Statistics. The amounts of stem cells released in vitreous body and retinal pigment epithelium, RPE, was analyzed by non-parametrical Crystal-Wallace test. The results of the electroretinography obtained before and after vitreous stem cells placements were analyzed by Friedman non-parametric method, since measurements were repeated in the same animal. Statistical analysis of the data on the amount of stem cells released in the vitreous gel and retinal pigment epithelium was evaluated by the Crystal-Wallace non-parametric method, which considers the samples of small size. No alterations were observed in the electroretinogram before and after stem cells implants. The results obtained in the histological sections of the enucleated eye of the rabbits of the control group without stem cells implantation showed changes at the level of chorioretinal tissue, like large areas of fibrogliosis, at 90 days after laser impact, phase of healing. In the 50 rabbits, symmetrical impacts were made with the 670 nanometer red diode laser, with a power of 600 microwatts, a 100 micromillimeter sight, in an area of 503,000 micromillimeter in the temporal retina, near the optic nerve. The results obtained in the histological sections of the nucleated eye of the rabbits of the stem cell implants group. Phase of chorioretinal healing, 90 days from laser impacts. We observed a recovery of 90% of chorioretinal scars in 23 rabbits, N equals 45 laser impacts recovered. In 2 rabbits, there was a recovery of 50% of the chorioretinal scars, N equaled 25 laser impacts recovered. In 3 rabbits, recovery of the chorioretinal tissue was 42%, N equals 21 laser impacts recovered, and in 2 rabbits, a recovery of 36% of the chorioretinal tissue was observed, N equals 18 laser impacts recovered. All rabbits presented hypopigmentation halo in the retinal pigment epithelium at the level of scar tissue recovery area. The recovery was in almost all of the retinal and choriocapillary tissue. The value of P obtained was more than 0.001. Electroretinography waves A and B. Before and after implants, no changes were observed. The future of stem cells is now.
I hope this presentation has been to your liking, and if anyone wishes to share the result of your own work or have any concern, you can contact me at my personal email or through my personal page. I want to thank again the management committee of this Congress and all of you for taking an interest in my research work. Thank you very much.